I was born at Sharon Hospital.
I was born at Sharon Hospital.
I was born in Sharon Hospital.
I was born at Sharon Hospital.
I was born in Sharon Hospital.
I was born at Sharon Hospital.
There's one student here who, when they came to register for kindergarten, on kindergarten registration day, I introduced myself to the student's mother. I extended my hand and said, I'm Claire, I'm the nurse. And the mother said, oh, actually we've met. You took care of me at Sharon Hospital. And I looked, and I really did remember right away. When I saw the name, it all came back to me. But that happens more often than you might suspect, and that's always really nice.
In 2018, our small hospital in rural Connecticut announced that it would be closing labor and delivery, which would light the flame of a long battle between Newman's Health and the people of Northwest Connecticut.
Well, for residents here in rural Litchfield County, if Sharon Hospital closes its maternity wing, the next nearest labor and delivery center is 40 minutes away, and that doesn't include the time it takes for an ambulance to get to you.
Well,
yeah.
What is that?
It just switches the amount of focus. This curtain might be a little bright though.
The closure of maternity, it's gotten a lot of attention because for very good reasons, right? People feel very passionate about it. It's a wonderful unit and we give really good care. So people are very passionate about it, but it's just a piece of the overall plan. And it's an important piece because that piece has to work to connect the whole puzzle. The world of healthcare has changed over the years, and it will continue to change for many, many years to come. But like anything in life, things aren't like it was in 1980. And as a hospital, because we deliver healthcare to our community, we have to change. So we look at who lives in the communities that we serve, how old are they, what do they need, what services do we have to provide. Because when we look at being a small community hospital, it's hard for us to do everything, right? Meaning we want to add services that we don't have, such as we didn't have a neurologist here, someone that treats issues of the brain. Because when we looked at everyone that lives in our community, we said, this is something we need. And then parts of our plan, our overall plan, was to say what services maybe we don't need as much that we're providing. Maternity was one of those. The reasons that we proposed to close the maternity unit is the maternity unit is underutilized. There aren't a lot of patients that access that unit, or a lot of moms and families that deliver babies on that unit when compared to other services that we offer at the hospital.
The state of Connecticut is claiming that as a nonprofit, they have a service to give back to the community.
We want our community here to be diverse, robust, healthy, all of these things. And in order to be able to attract and keep young families in particular, people need to know where they're going to have children and that there's a really high quality maternity facility that is accessible to them. You know, the governor's been quite clear that it will attract young families and keep young families in the state of Connecticut. Having access to maternity is a really important part of that. So the maternity ward is really important.
One of the most important considerations is the cost of running specialized units such as maternity services.
To run a maternity unit, to run any unit in a hospital, it costs money, right? So you have to pay for electricity, and you have to pay for supplies, and you have to pay for all of the people that work on the unit.
I think it is important that the units stay open. On the other hand, it's very expensive to staff a maternity unit. You have to have highly trained, skilled physicians and nurses and support staff 24 hours a day. It needs to be ready to go around the clock, 7 days a week. And it's really expensive to have a unit like that staffed. Say you have a small community hospital and they deliver approximately 300 babies a year. Maybe one a day on average, but you may have no deliveries for 3 days. And then you may have 3 women in labor on one day. So it's very, very difficult to staff the unit because you just have to be ready to go at any time.
How do we best utilize the resources, and by resources I mean the staff and the money that we have at the hospital, to serve our community in the best way?
Uvance and many of the other healthcare systems in the state of Connecticut are not-for-profit. And all that means is they don't pay tax. And in return for that freedom from paying tax, They owe to the community what's called a community benefit. And so they have to provide some service in order to make up for the fact that they don't have that financial obligation.
How does it work in our democracy? A government elected by the people can sometimes intervene.
As a hospital in Connecticut, the state has processes that a hospital has to follow if they want to change certain services at the hospital. What we are looking for from the state of Connecticut is support. And we need the support from the state of Connecticut in order for us to transform and evolve so that we're here for many, many years to come.
The relationship between Sharon and the state, much as any other hospital in the state, is the fact that because healthcare isn't an entirely private business, it's something that government has a great deal of interest in for the common good, it's heavily regulated. And so Sharon Hospital and every other hospital in the state has to check in with the state in order to before they can't do things on their own without the approval of the state. To that process, Nuvance applied to the OHS for permission to close the labor and delivery unit. A number of community groups, including a group called Save Sharon Hospital, got authorization to be a party to that proceeding.
We had a large rally at that time, and we had local public officials come and speak, and the doctors speak about the importance of keeping maternity open. And then all those community members signed letters to OHS and then to our elected officials at the state and federal levels.
And OHS ruled that Sharon Hospital was not allowed to close that facility.
As the battle between Nuvance and the people and representatives of Connecticut continues, nothing is certain.
The biggest new thing that's happening with Sharon Hospital is that they recently announced there is going to be a merger between the Sharon Hospital corporate owners called Nuvance Health and Northwell Health, which is a very large New York-based hospital system. So our next step is to decide whether or not we are going to try to be interveners in their application process to make sure that Connecticut State understands how important it is for Sharon Hospital to continue to provide vital services in the Northwest corner, despite this merger happening with this very large New York corporation.